Hi, you guys. So I know that there were some like miscommunication and rescheduling, and we were supposed to have this last week, and then the Zoom link wasn't working, and
Mhm.
now we kind of threw this together. So there's not too many of you today. We'll keep it like relatively informal. And
Mhm.
I just kind of wanted to go through and talk and discuss like my experiences when it came to med school. So like from pre-med, applying to med school, getting into med school, and then just kind of things that have helped me through the way. If this is something that, uh, could be valuable for you or, whoever. So let
Mhm.
me see if I can pull up. I threw some quick slides together. So am I a host? Is there any way you could make me a host?
Yes, I'll make you a
Okay.
host right now. You should be one
Okay. And also, if you guys have any like questions about anything, you can just like shout them out and I can answer as we go. Again, just want to keep this super informal.
now. Mhm.
Let's see. Okay. So you guys should be able to see my screen. If you can't, let me know. Okay. Can you guys see my screen?
Mhm.
Okay, perfect. So in regards to med school, so I'll just start with like how I ended up in medicine. I just had very like early positive exposure to medicine. So when I was growing up, I was born in Canada, and I would like go with my grandparents to all of their doctor's appointments. And I just remember how like the doctor would make them feel so much better about whatever was going on, that it was just like a very positive influence on me. He was our family doctor, so he saw me too, and he saw my parents too, and just like very positive exposure. And then, kind of as I grew, I realized that this was something that I wanted to explore, something that I thought could be a really good fit for me. And I was lucky to kind of find people to shadow in high school, and that's when I made my decision. So I know everyone kind of has a different route. Some people decide that they want to apply to med school a little bit later, during college, after college. But I kind of had that, I guess, insight going into college. So I was able to structure my schedule accordingly. And I also knew I wanted to make tangible, meaningful impact that was more one on one, and medicine was the way that I felt like I could go about doing that. And so I'm going to talk about how I got started in high school and what I did to build my application. So, in regards to the first bullet point here, getting involved early. So, this essentially means that, it doesn't necessarily have to be, hands-on clinical experience. Oops, sorry, one second. So it doesn't have to be any hands-on experience, but it can simply just be like shadowing, showing interest, showing any kind of like enthusiasm to make sure that you're getting like a foot in the door. Um, there you go. And a lot of times you can go directly through like hospital systems, like you can sign up to be a volunteer through hospital systems. I personally found that that was just difficult to do for me because I think you needed to be 16, and I didn't turn 16 until kind of like a lot later. So the best way for me to go about this was actually like emailing doctors. So I would find doctors in the area, and I would just like kind of cold email and just say, hey, I am interested in medicine. I'm applying to medical school. I'm going to be pre-med. I would absolutely love to shadow you. And usually when you show this level of enthusiasm, people are very, very willing to give you their time and their guidance, solely just because of the fact that you are showing that enthusiasm. So I would kind of go about it in that way. If hospital systems aren't working out for you, they didn't work out for me until I was like in college at Michigan. Let's see. Another thing I did is I was part of HOSA, which is kind of like it's like a group of high school students, kind of internationally. And there's like a lot of different sectors that you can compete in, whether it's like public speaking, like research advancement, things like that. And you can, I believe I did public speaking like my first year. And then after that, I'm not entirely sure. I don't remember. But this was just a really good experience to connect with healthcare professionals and just like build my skills in leadership. I talked a little bit about clinical exposure, sending cold emails to physicians. I also want to talk about research. So I know when, at least when I was like in high school, I found research to be super intimidating. I didn't know anything about it. I didn't know how it worked. But I knew that it was something that could be important and useful for my application going forward. And so I decided to kind of do something similar as I did with the doctors that I shadowed, where I kind of cold emailed professors who were doing research at like a local university. So I live in like the Detroit area, but I went to University of Michigan for undergrad, and so I just found professors that were doing any kind of like science-based research at Michigan, and I just like told them that I was in high school. I was really excited about pursuing medicine, and I sent them my resume. So just so that they had a little bit of background and information about me. And I just asked if they had any spots available for like any help I could do with research. And again, usually when you show enthusiasm, people are relatively excited to help you in the same way. But obviously when you're in high school, it's a little bit more difficult to establish that grounds and that footing. And so I sent, I think, 160 emails, and I had one person say yes. So you have to be okay with having people reject you or not respond, because at the end of the day, it only takes one person to say yes. And then you get your foot in the door and you get that exposure. And especially if the person who's running that research program is also a doctor or a physician, which a lot of times they are, this also gives you access to additional like shadowing opportunities that you can like list on your resume. So you're building a relationship with someone simply by putting yourself out there and being open to people saying no, because you only need one yes. Okay. So one of the questions that you guys wanted me to talk about is how hard is it to get into medical school? It is difficult, but absolutely not impossible if this is something that you really, really want to do, and this is the only thing that you can see yourself doing, as was for me. I would say it really does have to be intrinsically motivated and intrinsically driven. If you internally are the one that wants to go to med school and it's not from like outside pressures, then I see absolutely no reason that, you could get into med school and complete it successfully and then obviously continue your career. My statistics, so my MCAT was at the 86th percentile, and I had a 3.8 GPA when I applied to medical school. I applied pretty broadly, 27 schools. What I did is MSAR, I believe it's called, is a resource that you can buy for like $25. It's on the AAMC website. It's linked somewhere on the website. And basically it lists every single medical school and all of their statistics. So what's the average MCAT of the people who were accepted? What's the average GPA? Where is it located? Like, what are some affiliated programs, things like that. And you get a lot more information about these schools. So I used MSAR, and I went through all of the medical schools, and I found schools that were kind of around my statistics. And I picked a couple that were like way above my statistics, and I picked a couple that were also below my statistics just to kind of have more of a cushion. And I came up with 27. This is also relatively like expensive. It's like, I would say like maybe like $40 per school for their primary application. And then for the secondary application, it's like $100 to $200 per school. Some of them I believe are free, but it's just also important to recognize that you have to budget for this. And I was lucky that my parents were helping me with it, but that's probably one of the limitations that people have in regards to how many schools they apply to as well. I had 3 interviews, 2 acceptances, 1 rejection. It was funny because the school I got rejected from, I thought it was my best interview. So that just goes to show that even if you feel terrible about an interview, or if you feel great about an interview, it doesn't necessarily matter much. At the end of the day, you're going to end up where you're meant to be. And I'm very happy at my school. Okay. Biggest challenge in healthcare. So I would say we can look at this from like a patient perspective, and we can also look at this from a like physician perspective. In regards to patient perspective, there are things called social determinants of health, like education access, healthcare access, neighborhood and environment built, economic stability, social and community context. And all of these factors kind of play a very big role in the way that patients can take care of their health. So I go to med school in Detroit. I have a primarily underserved population here, a very urban population. So a lot of my patients struggle when it comes to, simply accessing the care that they deserve. Whether it's because of like issues in regards to transportation, maybe they just don't have a ride to the doctor's office. That's actually a very big problem that we found in this area, which is sometimes why we have up to 50% of patients not show, because they just don't have a way to get to the doctor's office. So these are pretty big challenges that patients can face, that we need to be mindful of when we're treating our patient population, because obviously we want to address these barriers to care, not only so that we can see our patients to make them feel better, but also so that we can consistently see them. So it's about continuity of care as well. And then in regards to a patient perspective or a physician perspective, these are kind of some of the reasons that physicians have listed that cause burnout or make them feel like they don't have as much autonomy or as much control when it comes to practicing. And so, for example, like, maybe it's like the hours or, lack of autonomy, lack of, the way that they might have systematic regulations at whatever institution they work at that make things harder for them. Emphasis on profit over patients, which is a very big one too. So there are some kind of challenges that you will come across on your journey towards med school. It's important to be cognizant of them. And then, obviously, whatever you can do to address those is important too, whether that's on like a research level, so it's systematically implemented, or whether that's on like an individual level. Okay. And then the next one. Okay. So how has being South Asian female impacted me as a future doctor? So I am a first generation medical student, which means that I don't have anyone in my family who attended medical school before me. Women also have to sometimes work harder, unfortunately, to prove themselves as compared to their male counterparts. And I've noticed this when I've worked as a medical student. And I also noticed this in undergrad too. And there's also sometimes instances where, for example, me and a male colleague are going to see a patient, and the patients will address the male colleague or think that the male colleague is the doctor when we've both introduced ourselves as medical students. So it's kind of interesting, like an interesting dynamic that women have to face. And I wish it was a fight that we didn't have to fight, kind of constantly speaking up for ourselves, advocating for ourselves. But I think it's important to recognize if you feel that way, you're likely not alone, but it's very important to continue advocating and continue speaking, because that's how we're going to, see any sort of change. I haven't perfected this. Sometimes it's difficult. A lot of times, even if I'm getting addressed as like sweetie or honey or nurse, sometimes it does not feel right, because I know that my male colleague would not be addressed in those ways. And so just politely redirecting and correcting the patient is okay to do. And because, we're working really hard for where we're at. So correct, educate, advocate. I've experienced certain battles, as will you, but it's absolutely important for us to keep fighting the fight. Okay. And there were some additional questions that were sent to me too, and I can go through some of these briefly, but I actually want to see if there was anything you guys are interested in or anything that you guys want to ask me first. I see Manpreet said that she's in HOSA, and you did a research poster. That's really exciting. Yeah, HOSA was like a phenomenal experience for me. I had so much fun. I met a lot of people through it. So if you're doing HOSA and you're still in, I don't know where you are in your high school journey, but I would definitely recommend keeping that up. And, you know, any other areas where you feel like you can make a tangible impact, or honestly, just areas that you find fun. Like not everything has to be about, you know, this like big deal. Like it can also just be a hobby, something for you, something that you enjoy, because otherwise you are going to burn out. Like when it comes to burnout, sometimes I even feel like I feel like I've been just like going. And I technically have not had a break since September, because in September we had a week off and I took that week off, and then we had like 3 months of rotations. Over December, I was studying for an exam that I had pushed from previously that I was going to take in January. And then from January to March, I was on my surgery rotation and I was working 6 days a week, doing like 28-hour call shifts 1 or 2 times a week. So I was definitely exhausted. And then when April started, I did like this April, I did my ophthalmology rotation. So I'm applying into ophthalmology. And so when you're doing your rotation in the specialty you're applying into, you're trying to put your best foot forward, make sure you're impressing everybody. So you have to be like on for, you know, how many ever hours, like 9-10 hours in a day, which can be kind of exhausting. So May is going to be my research month, and this is my first break since September. So I'm very, very excited about having this time to myself. Okay, what kind of extracurricular activities do you think are related to the healthcare field? So in regards to extracurricular activities, if you're talking, are you talking about like pre-med or high school or college? Because I think there's like a distinction there. So I would, I just actually found out that one of my friends, her sisters, okay, high school. I found out that one of my friends, her sisters, she works as like an MA or like a medical assistant at a dermatologist's office. And she does, you know, through that, she gets a lot of like patient interaction, but the doctor that runs the practice also lets her do a little bit more, like taking patient histories, helping with notes and things like that. And so if you can find yourself, again, this is through like you putting in the time, doing your Google searches, like finding maybe offices where you could potentially be a good fit, and like cold emailing and just showing interest and enthusiasm. But if you can work as an MA somewhere, or if you can work as a scribe somewhere, that could be really, really good for your just to like prep for your application. And again, if you're in high school, like you're super early on, so it will look phenomenal that you worked as a scribe or as an MA in high school. You can even do, like I said, like shadowing is very, very valuable. Research, if you're able to get involved, doing things like that. You're already involved in HOSA. I also did DECA. So it doesn't necessarily only have to be like healthcare related. You can still do things that are outside of healthcare. I was, I did DECA. I was president of like art club. Like I did a lot of other things too. So just make sure you also diversify based on whatever your actual interests are. I worked as a scribe. So I graduated from U of M in 2018. I graduated in like 3 years just because I wanted to expedite it a little bit. And it's also like super expensive. And I was like, why not if I can just kind of get it done? So I finished in like 3 years. I worked as a scribe for 6 months. I worked in an allergy office and I worked in a pediatrics office. And it was really good experience. It looked really good on my application, and I was applying to med school when I was scribing. So it was cool to kind of like talk to the doctors I was working with about all of that. So essentially it was more so like experience building for me. And then on top of that, I also was able to like put that on my resume. I think scribing looks very, very good on on applications. Yeah, because you are essentially writing notes for the doctor. Like you are learning how to write notes and you're writing them. And if you have experience scribing for like multiple years when you're applying to med school, like you essentially know how to do all of the history taking, which I would say is probably the most important when you're speaking to a patient, is getting all of the correct information and getting all of the history. So if you can like learn how to do that, you're going to be like one step ahead of all of your colleagues when you start med school too. So it'll be helpful.
I had a question. So you were saying that you just applied to all these like research projects and like just
Mhm.
doing like the MA and everything. So
I didn't do the MA, but I know a friend
okay,
who did that. I
right.
scribed in college and I would send cold emails for shadowing and research.
Okay, so then sending those, would you just type in like what would you type in on Google? Like that's my question.
Would it, okay, so if there's like a university
Like,
like that's local to you, you can just say like University of X and then literally just put in like research. And you can even put in like a department. Like for example, if you want to do research in like dermatology, you could say dermatology research. And then you'll like pull up different, maybe like professors, different projects. If you have people at that college currently, like for example, like if I was applying for projects at Michigan before I was actually admitted to U of M, what I would do is I would, if I would know anyone at U of M, I would ask them to get me these people's emails, because sometimes the emails aren't as easy to find or as clear on the website. So sometimes the most difficult part is actually getting access to the emails, but I was still able to like find the emails like I online somehow. I think I just like looked for the projects and looked for the doctors, and sometimes they're like just directly listed on the website. But good question. Also, if you guys like, if it would be helpful, I could like go find my email templates if you guys want like a reference of how I structured it. But typically it was just like, hi, my name is Hummel. I am a high school student, or I can say like I think it was the summer before my senior year. So I'm about to start my senior year of high school. I'm very excited about medicine and applying to, and I will be applying to medical school. You can put that, and you can even just say like, I'm very interested and enthusiastic about research in dermatology because, and then just like talk about why dermatology is interesting to you. So they know that you did a little bit of research about what it is that they're looking into. And that way they'll maybe be more likely to at least respond. There were some people who did, I would say like a lot of people also just didn't respond to me, but it didn't end up mattering. So it's fine. Let's see here.
Yeah, there's a question in the chat. So it's just asking, how did you decide what college to go to when you were interested in pursuing a career as a reconstructive surgeon?
So, well, this is a good question. I don't know if I want to be like a reconstructive surgeon yet. I do want to be an eye surgeon, but we're going to kind of figure out if I'm doing plastics or not later. But if you are interested in, so do you want to do plastic surgery? Okay. So I'm not going to, so plastic surgery itself, actually, I'm glad you asked me this question. Plastic surgery itself is a relatively competitive specialty. I would say it's one of the most competitive. So that's why it's good that you're getting involved sooner and quicker, because you'll have years to kind of build your application and build your experience for like the residency process. We had, I think this year we had like 10 people apply directly to plastics. So you can do an integrated program where plastics is 6 years. And you can also do a program where you do general surgery first, which I believe is 4 or 5 years. And then you apply into a plastics fellowship, which is like 3 years long. So there's 2 routes to get to the same method. One of them is just a little bit harder than the other. General surgery is easier to match into, but it's just known for a very rigorous lifestyle. Like you are on call, you're working those 28-hour trauma shifts, you're going to be relatively busy. And plastics, if you go directly into plastics, you're still going to be busy. It's a surgical specialty, but it won't be like the 8 years. It'll be 6 years of you just doing mostly plastics. So it's good for you to know that there's 2 ways that you can go about it. I think I believe people can also dual apply, like you can apply to Gen Surg and you can apply directly to plastics. This year we had, I think, 10 people apply plastics, and I don't think anybody matched into plastics directly. I think people matched into Gen Surg first. So I would find surgeons who are role models to you that you look up to that are in the area and just email them. Just be like, I'm really excited about reconstructive surgery. It's my passion. I have, talk about why you're passionate about it, what makes you excited about it, and drop your resume, drop your information, and just show that willingness and enthusiasm. I think that would be probably the best bet. But also, this is something you don't necessarily need to be too stressed about in high school. I would say maybe when you're like a pre-med and you have like a hospital system nearby, you'll also have more access to these kind of surgeons. Would that email work even when you're a high school freshman? Yeah, it would. And that's what I'm saying. Even if you're a high school freshman, the fact that you're already like asking these questions and showing this enthusiasm, like it shows that you're very interested and invested in this. So that will shine through in whatever email you send. You don't even need to, if you're feeling a little bit like, oh, I don't want them to think that I'm too young, you can even just like leave out the freshman part. You can say like, I'm a high school student and I'm interested in this because XYZ. But I honestly don't think that that'll hurt you. Just don't get discouraged if people say no is my biggest thing, because you just need one person to say yes to you. Reconstructive surgery, I also wanted to say one more thing. So I am applying to ophthalmology. Ophthalmology is eye surgery. You learn how to do things like cataract removal, and there's different even subspecialties within ophthalmology. So you can do retina, you can do cornea, you can do pediatrics, you can do oculoplastics. So this is something that I would explore if I was you, because I didn't know about this until like a couple years ago when I decided on ophthalmology. But oculoplastic surgeons are also plastic surgeons, but they operate mostly outside like the eyeball. So they do a lot of like reconstructive surgeries. For example, if you have melanoma or like carcinoma on your eyelid, you would want a oculoplastic surgeon to take care of that because it's a cosmetically important location, but then also it's surrounding the eye and the orbit, and they have training in ophthalmology. So they know what they're doing and they're not going to affect your vision. So I've actually found out that oculoplastic surgeons can also do like eyelid surgery, they can do facelifts, they can do like a lot more in their scope versus like, I believe when you do plastic surgery, you can operate on like other parts of the body too. But if you really like technical surgeries and detail-oriented surgeries and you like the eye, ophthalmology is an incredible field. And then you could pursue oculoplastics where you kind of just like work on the face. Okay, awesome. And I have another question. When you say you started in high school, which grade precisely? So in regards to extracurriculars, I started those like from 9th grade. I would say I started to kind of slowly get involved. And so that by the end of like my 4 years, I had some more leadership positions, like as a senior. I think when you get involved early, that's one of the biggest benefits, is because you can kind of like move up in your contribution to whatever organization you're passionate about. So I was hostess secretary, I was art and medicine, or I was art club president, and I did a couple other things. I played lacrosse, and all of that. It kind of helps that I started early to kind of get to that level during senior year. In regards to like shadowing and research, so research I did the summer after my junior year. Going into my senior year, that's when I started research. You could get started early. Like I honestly don't think, I think that if you're motivated and you're willing to read and learn about the project and really get involved, then you could start early. For shadowing, like I said, I really struggled getting into like any hospital system because all the spots would be full all the time. And also I wasn't 16 until like December of my junior year, and you needed to be 16 to apply. So I kind of like didn't really have the access, and I found that sending emails was just more useful. So
So,
yeah, I don't, mhm.
oh, sorry.
No,
Um,
I wasn't. I was just saying I don't think there's a such thing as too early in high school. But go
mhm.
ahead.
So for your research, what did you do in like for
So
helping the people? Yeah.
yeah, so I was just kind of like, I will do whatever. Like, I will come in at whatever you need help with, I will do. I will, if you need help with certain parts of the project, I'll read up on that so that I know what I'm talking about and I know what you're doing. It was definitely more difficult because I didn't have as much of a base in like the sciences, just because I was in high school and you don't get a lot of exposure to like human anatomy and physiology. I had just taken like one class in regards to that. So what I would do, I did wet lab research. There's wet lab research and then there's clinical research. So clinical research I think is more fun. You actually like will talk to patients, so consent patients. It's more like data collection. Wet lab research, you do a lot of like wet lab bench work. You're mixing solutions. It's really um, I would say the facilities that have really good wet lab research have a lot of money. Like you need money to do this kind of research. So U of M was like really good for it. And what would I do? So if they had like research meetings, I would go to those weekly research meetings and I would kind of sit in and see what they were talking about. So that was kind of the first exposure that I had. I started shadowing him in clinic. So I had a lot of like clinic exposure to this neurologist. I You will have to do some like random stuff too. Like for example, if you need to like clean certain beakers or you need to wash this or you need to do whatever, like I was kind of open to doing all of the grunt work just so that I could get the exposure and the access. You don't have to, and I would say go into it with that mentality. Like you don't have to be super involved in like everything that they're doing, but just kind of observing, being in that environment, being around that environment, you'll pick up a lot of things and you'll learn a lot. And like they'll continue to give you more and more tasks as they see your enthusiasm show, if that makes sense. Because you kind of also have to like showcase that and prove yourself because they don't know you yet. Is research experience beneficial to you only or good for college med school applications? No, it's great for college med school applications. If you do research and you're able to get published, or even if you can get an abstract, or if you have any part in like data collection, they have to put you on the paper. And if you list that in your application, it will look really, really good. Not only for college applications, but also for like med school and also for residency. So I just found out I'm getting published for in ophthalmology, and so that's something that I will list on my resume when I apply to residency this fall. Yep. So good question. I honestly think research is very, very, very important, even if it's something that you're not super into. Like I don't love research. I don't like, I'm not like every day I want to do research. No, because I am a clinician. I like to see patients. I like to be in the clinic. I like to be in the operating room. But research is also very valuable because you can get a lot of tangible information from it and you can make systematic changes at your facility, which is really cool to see. Like in undergrad, I did research actually in internal medicine, and that's when I didn't know I was applying to ophthalmology at the time, so I was just kind of doing whatever research. And I actually went into patient rooms. I was consenting patients. I was asking patients survey questions for like putting up a whiteboard in the room. So we were trying to determine whether patients actually saw value in the whiteboard in their room, or if they used it or how they used it, if we needed to change it, if we needed to redesign it. So we got a lot of really cool information, and we actually were able to redesign some of the whiteboards that were actually put up in the hospital. So it's cool to see your research translating into something that's tangible and impactful. I hope that helped.
Oh, that's amazing. All your experiences are so full of so much knowledge and stuff. So thank you for that.
Yeah, no, I appreciate you guys having me. And honestly, this is just stuff that I figured out on my own as I moved through my career. So if I can help you guys get kind of a foot in the door, that makes me really happy that I can do that for you. So I hope that this was helpful. I hope that it was valuable. Do you guys have any other questions? Anything else I can answer? Okay, so if not, you guys have my Instagram. Feel free to message me about whatever, whenever, and I'll get back to you as soon as I can. I will probably be just doing a lot more mentorship this coming month because I have a lot more time, which is exciting. And, definitely let me know if there's anything else I can help you with. Good luck on your journey. I'm sure you guys are all going to do amazing. You guys are so enthusiastic and asking all these questions, and, it's going to be great. So thank you guys.
Thank you so much. So it would be great if you could share the email template, and then this slideshow that you have, that'd be really helpful too if you could share that.
I can do that. I will. If you guys just send me your email, I can email that to you, and it might take a little bit for me to dig up my email templates, but I can find those too.
Okay, so did you want me to put my email in the chat?
Yes, and then I'll just take a picture of it. You can just put it. Okay, perfect. Okay, I just took a picture of it, and I will send that to your email. Okay, thank you guys. Thank you guys for coming, and I hope this was helpful.
Thank you so much.
Thank you.
Bye.